Our guest today is a nurse practitioner that specializes in aesthetics. Please help me to introduce aesthetic provider Patricia
Molle. Patricia Molle of Molle Aesthetics, located in Jupiter, Florida.
Amazing. I'm so glad that we were able to do this today.
I know, me too. I've been waiting for this. I'm so glad that you guys were able to actually come.
Hey Patricia, how are you today?
I'm doing well. How about yourself?
I'm doing good. I have so many questions for you today, so let's dive right in.
Yeah, let's do it.
So tell me, how has everything been since the beginning of COVID-19 until now?
Right. So COVID was a little tough. Obviously, the industry was in a freeze standpoint, I would say. Patients were a little scared to come out and, get injections, potentially get exposed to a virus that none of us really knew what to anticipate with it. So in the aesthetic industry, it was difficult. Once people started to warm up and feel more comfortable, everything started to kind of get back to normal, I would say. People were ready to get injections and get back to feeling and looking great.
Nice. I know it was a lot of people succeeded in that during COVID, and a lot of things that bad happened during that time too.
Yeah.
And I know you started your business during that time. Tell us about that.
I did, yeah,
Wow.
I did. I actually worked with a plastic surgeon for nearly 2 years, and that during COVID, patients, everything kind of got shut down, and during COVID, it's wild, but a lot of business opportunities presented, unfortunately, due to circumstances. So I was able to actually find a location, and I just slid right in, and everything kind of just opened up for me. I mean, COVID was not a good experience for a lot of people, but as a business star, it was very good to me. So the opportunity presented, and I took it, and everything has been great since.
Nice, and we're inside right now.
Yeah.
Nice.
Yeah.
So what services do you offer here?
Okay, so I do medical injectables, primarily toxins, dermal fillers, and then I also do microneedling with PRP, the vampire facial. I kind of stick to a couple things. I'm just more focused on providing really good results, and I feel like when you're good at a couple things, you can achieve that. When you have a lot going on, it's a little bit more difficult, if that makes sense. But yeah, that's my primary focus.
I agree. Being very niche in a field to really be your best at that.
Yeah.
And then expanding more is exactly where you find your pinpoint.
Yeah, exactly. Yeah.
Yeah.
I mean, I think that's the same for anything, really. Whether it's medical focused or any other type of business relation, you really have to be good at one thing to be well known.
Yeah.
You know what I'm saying?
I agree.
Yeah.
I agree. What is your most common procedure that people want the most?
I would say 98% of my practice is Botox.
Wow.
Or toxins. Yeah. I do a lot of that, more so than any other procedure. Obviously, the appointment is more convenient, it's quicker, but when it comes to dermal fillers, I do a lot of lip augmentation.
Nice.
Mid-face volume correction, whether that's cheek enhancement or jaw, chin, things like that. But I would say 98% of my practice is definitely toxins.
When you're approaching a patient, I guess consulting with a patient, are you really big with the facial balancing?
Absolutely.
Is that
Absolutely, because not one person is created equal. So everyone has asymmetrical findings, and I find that a lot of people don't even know that they have that. So my job as the injector is to kind of equalize what they have going on, and I don't like to pinpoint. I'm not one to say, oh, you have this flaw, or this deficit. I don't like that. I don't feel like a lot of people take well to that. So unless they ask me what would I do, then I dive in and I'm honest with them. I feel like honesty is the best policy. But yeah, facial balancing is really key, and it just gives you a harmonious look, and that's what I think a lot of people are striving for.
Yeah, no, I can agree. Yeah. Being a business owner, is there any trends that you're seeing right now in the industry that people are suggesting or wanting, or you're like, I want to try this out? Or
honestly, I just got into the microneedling with PRP, aka the vampire facial, And I feel like that's a newer trend in the past couple years. PRP injection, or doing it with the microneedling, I feel like is phenomenal. That is a new trend that I have got on, and I really love the results. My clients love the results with it. It's rejuvenating, and it's something that there's no downtime with it, and I really love that. Especially being in South Florida, it's very difficult to have downtime and not be able to go outside and do things, and people find that very limiting. So to offer a service where there's no downtime with it, I really love that.
Yeah, no, I can definitely agree, because I got a chemical pill a couple years ago, and it's like,
right?
You're in the house for 1 week.
Correct. And you can't wear makeup, which with the vampire facial, you can't wear makeup for 2 days, but the peeling, you don't want to be seen. You can't do anything to cover that up, and at least with dermal fillers and stuff, after a certain time period, we can wear makeup over it and kind of hide bruising and swelling to some degree, but with a lot of laser treatments and stuff, it's a little bit more difficult. So people tend to shy away from that, even though they're fantastic, and I love laser therapy.
Nice. Yeah. That's really interesting, because like PRP can now be used in like the joints and everywhere.
100%.
So
I feel like it actually started in a joint perspective, and once holistic practitioners started seeing that it was effective, and it was able to be injected into other areas for hair regrowth, like in the scalp. Obviously, I have injected it into the face just to help kind of enhance and build that, collagen response. But doing it with the microneedling, I really love, because I feel like it gives the skin just a nice refreshened appearance. It helps to combat those fine lines. It helps to just improve the skin complexion. And down the road, that's what we all want. Especially living in South Florida, the sun damage is intense, and it ages you, so we have to combat that, and doing things like that really help the process.
Yeah, I've seen the pictures on Instagram where it's like sun damage on this side of a trucker's face, or even like sleeping, the way you sleep. It's interesting.
Yeah, I know. There's a lot involved when it comes to aging, and it can be scary, because no one wants to age, but we all are going to age. So my goal for my clients is to age gracefully. That's what I help everyone achieve when they walk through my doors.
Does the blood have to be like, do your blood has to be a certain type in order?
Yeah, no. So basically the blood is separated from the red blood cells into the plasma cells, and the plasma cells is the purest form. So that is what is used as far as the plasma injections, or the plasma applied topically with the microneedling device, which I have the skin pen, which I love. I'm very happy with it. It's given great results, so yeah.
Amazing.
Yeah.
So let's start back in the beginning. Okay. How did you get into the aesthetic industry?
Wow, okay. So one of the best decisions in my life, career-wise, I have a background in emergency medicine.
Nice.
I worked in the emergency room for 10 years at a local facility up in Martin County. And after being in the ER as a nurse practitioner, 2 years into my career, it was a lot. It was very overwhelming as far as hours. It was physically demanding, mentally demanding. And I just knew at that point, I was like, I don't think I can do this for my entire career, even though I thought I would. And one of my friends, colleagues, is an aesthetic injector. And I asked her, hey, like, how did you get into this field? And she basically was like, do this, and you'll be good. And because of her, she really gave me like the fundamentals to proceed. And I kind of found my path, and left the emergency room and became an aesthetic practitioner.
Wow, that's amazing. That's really amazing. I get so many providers are in the ER, and they want to switch. They want to switch into aesthetics.
Yeah.
But they're nervous to leave the hospital setting and switch to an outpatient setting, because there's so many risks as far as like a lot of medical spas don't offer insurance.
Yeah. Absolutely, I know it's an unknown, path. Like, you don't really know. I mean, I have been a nurse practitioner now for it'll be 7 years in May.
Wow.
I found my way and took the risk and did it. I loved the emergency room. It taught me so many things about medicine. I was able to work with 32 different physicians at any given time. So medically, I was exposed to every health condition, every problem. I've experienced every patient population that you can, encounter. So the emergency room really gave me a good, like, fundamental system to medically advance myself. And holding a needle is a breeze to me, thank God, because in the hospital setting, in the emergency room, you stitch a lot of wounds, a lot of, like, lacerations, traumas. I have stitched, sewn, I can't even tell you, hundreds of thousands of patients in my, career there, whether they were infants, children's, people in their late 90s, hundreds. Like, I'm so comfortable holding a needle because it's one of those things where you just have to do it and get used to it and get good at it. So that was a really good foundation for me, which I find a lot of people holding a needle, holding a syringe can be a little bit intimidating too if you're not used to doing it.
And that's actually good to know, because a lot of people, like I said, are on the border, and now just hearing that, you're gonna be like, wow.
Yeah. No, it's something that I got comfortable with, and I feel like because of that, it led my path to where I am today. So I'm totally thankful for that exposure that I had. But people leaving the hospital setting, it is intimidating. I, went back and forth with, am I ready to do this? It was the unknown, monetarily. The hospital, they do give you benefits and everything, and it's security. Mm-hmm. But if you really want to do this and you really want to make the move, you just have to jump right in and just do it. That was the best thing. Nice.
Yeah. And obviously it paid off, so.
100%. Yeah. I'm so happy. It's the best choice that I have done for my career in my entire life.
Wow.
Yeah.
What are some of the benefits of working in an outpatient setting like this?
Oh my gosh, everything. I mean, like your hours, your quality of life. You set your own schedule. I mean, I work for myself, obviously, but if you do work for a medical practice that, if you're with like a plastic surgeon or whichever, you work with them, but you still get that, quality of life, that 8 to 5 life, and no holidays and no weekends, and that's a big benefit. People really take that for granted. I took that for granted for a long time, and once I got out of that hospital world, I'm like, oh my gosh, like, the quality of life is different.
Yeah. No, I agree. I can agree. It's definitely meant for, like, a contractor type of atmosphere. Like, you said, picking your own hours, like really being your own boss.
Right, correct. Yeah. For me, that's been rewarding and life-changing.
Yeah.
But so the outpatient perspective it can be very good and very rewarding ultimately.
Now, I know you said you worked for someone previously.
I did, yeah.
Do you have any advice you would give to new injectors or people that are coming in that want to get a job?
Yeah, absolutely. So it's difficult. There's a lot of training programs that are misleading as far as the skills that you need to have. And I feel like that's not fair for a lot of new injectors because they're trusting that these companies are going to really teach them. And some don't, and it's not fair. So as a new injector, I feel like finding an institute that is credentialed, that is focused on you and your skill set and where they need to build is key. Also, if you can work with a plastic surgeon, I mean, that would be the best thing too, or even like a dermatologist. I mean, those practices are all, skin focused, and obviously aesthetics and plastic surgery go hand in hand, but I feel like that would be key, is to either learn through a specialty office like that or really find a training institute that is focused on the right needs for you.
Yeah, and I would agree also, because there's not really like a residency program.
No, there's not.
So it's
there's not. And it's unfortunate. Maybe someone should create that we as nurse practitioners and PAs can attend and leave after however long, 6 to 12 months, and feel solid in our skill set. There's not anything out there. I actually received my training from a company in Orlando called FaceTime Aesthetics. Kevin Harrington, he's a nurse practitioner. I love him. His office, his institute is phenomenal. The skill set that I developed from that institute was completely, hands down, like the best.
Wow.
Yeah.
And how did you find out what vetting process did you use to?
Right. So Kevin, I came across Kevin. I honestly think I saw him on Instagram or I looked up aesthetic training when I was ready to kind of take this more, serious. And I obviously live in South Florida, so I had to find something local. I didn't want to travel. And Kevin's institute was in Orlando, which is not, too far. And it was really great. I mean, I literally went there, multiple sessions for 8 to 9 hours a day.
Wow.
And it was one-on-one training.
Wow.
It was phenomenal. Yeah. So I got to inject multiple patients, but it was one-on-one learning, and I find that so valuable. I just find if you're in a room with a ton of people, it's a little bit more difficult to really learn and focus.
Yeah.
There's a lot going on that can distract you very easily. But when I did this institute, it was focused, private setting, and I feel like super, super valuable.
And that's the key, that one-on-one. I can ask as many questions as I want.
100%, and you don't feel dumb.
Mm-hmm.
You don't feel stupid. Like, am I going in the right plane? Is this the right technique? Like, you don't feel, it's just you and this other person. So I really love that, and I love to teach like that. I feel like you get more out of it when it's just you and another person.
Now, I'm a strong believer, whether you're working for like an office or you have your own spa, you are a brand of your own.
Absolutely.
And you're building that every day, whether it's via Instagram, LinkedIn, or even when you're speaking to patients one-on-one.
Yeah.
Tell me, how big is branding for you, and kind of what did you do to build your brand?
Oh boy. So my last name is my brand, Molle Aesthetics. I love my last name. Always loved it. This is a little bit sentimental to me. My brother passed away when I was 15, and I wanted our last name to continue in our town. My sister owns a bridal store, and her company is called Molle Bridal. She has the same philosophy as me with continuing on with our I wanted to continue on with the legacy of my brother's last name, so our companies have instilled that. But yeah, branding is key. I mean, I find it's the more personal you are with your clients, the more they feel at home with you. Yeah. And I love that. It's just more intimate. So yeah, I found that doing something with my last name just, I don't know, it's part of me,
Yeah, no, I definitely can understand that.
I like to reflect that, and
Same. I mean, even my company has my last name.
Yes, it does. Right. It's just more personal. And I feel like if people get to know you on a personal level, they trust you. They value your opinion, It's not just an organization that they're walking into, a factory, and just a different feel.
Yeah, definitely. Has social media played a big role in your career?
Oh my goodness, yes. It has, absolutely. Social media, there's a lot of influencers out there, injectors that show their techniques and show their downfalls, and I love to learn. It's like a sponge. You just want to absorb. So social media gives you that access to see what other injectors are doing, how they're practicing, and of course, connecting with clients. Advertising, social media really gives that bridge. It's for people to find you. I find that a lot of my business clientele is word of mouth, referrals. All of my clients, for the most part, have been injected by me. They were referred to me, obviously, by someone that was injected, or they found me off of social media.
Wow.
Yeah.
Wow, it's super cool because I always say when an injector tells me that most of their business is word of mouth, that means they have good patient service, right?
Yeah, absolutely.
Because people are taking their name and telling other people, hey, go trust this other person.
100%, yeah. I'm honest when I say that. I would say 98% is word of mouth.
Wow, that's really cool.
I know.
Really cool.
I'm very fortunate to say that was my goal all along, because I want people to trust the process, and they need to trust their injector. So if you go to someone that has value, that your friend went to, your family member went to, and they loved it, that's great. You're likely to go see that same person also,
How big is community in this industry? Really meeting other people, having people you can call, mentorship, things of that nature?
Yeah, it's important. You always have to have colleagues to kind of fall back on, and questions and things that come up that you haven't seen before. I mean, I have several colleagues that I will, contact and say, hey, I had this kind of reaction, or just question this product. It's so important. Mm-hmm. It's so important. I mean, they're your friends. They're not, I don't look at it as competition. I look at them as friends, and they can give me really their wealth of information. We all are. We're all wealthy in our own information way.
Nice.
If that makes sense, I think.
Yeah, it does, because you know different things than someone else, right?
Correct. Yeah.
And it's like everyone can be good, like the niche. Everyone can be good in their niche, but when you have different questions and something else, you have that person that you can kind of bounce ideas off of.
Yeah.
So
and I know who is more experienced in those areas and who I can call. Yeah, absolutely. So community is key.
Nice.
In order to being successful.
Nice. Now on Instagram, I've been seeing a lot of like aspirating and people talking about aspirating.
Yeah.
Can you tell us a little bit about that?
Oh boy, 100%. Yeah, that is one of my main practices as far as techniques. Mm-hmm. I find it's crucial to aspirate. Mm-hmm. I feel nervous and scared for people that don't aspirate, only because I inject so often, and the things that I have aspirated unexpectedly in vessels that I didn't think that I would even be near can be really scary. It's you're potentially causing a catastrophic event for a patient, and our job in this field, whether you're in this setting or in a family care office, or you're in a hospital setting, whatever, our job is to not hurt people. We made a vow, and if you're practicing a little recklessly and you're not aspirating, you're potentially causing someone significant harm.
Yeah.
So I'm a firm believer on aspiration with every dermal filler, 100%. And sometimes I'm a little bit OCD with it, and I'll aspirate twice for 15 to 20 seconds at a time. And I have been surprised where if I have done that, I have aspirated blood even the first round for the first 20 seconds, I didn't. If that makes sense.
Yeah.
Yeah, and that to me was my heart drops, and I'm like, if I didn't do that, So yeah, safety is key. Safety is the most important aspect. Always, whatever setting you're in. If you're a medical provider, you have to protect your patients.
Definitely.
Always.
I can definitely understand. That's amazing too.
Yeah.
Is there anybody on social media that you would recommend for providers to follow?
Yeah. I love Aesthetic Injector, Injector Bunny. Those are the main two accounts that I follow. I just feel like they're very cool and chic, and they're also conservative with their practices, and I love that. I don't overfill, I don't over-inject. That's just not how I practice. And I love to follow people and watch how they how they inject, if they're on that same level of being conservative but still being effective.
How do you deal? I know you say you don't overfill, over-inject. How do you deal if a client comes to you and they're like, "I want this"? How do you deal with that?
Yeah. I kindly respond, and just try to tell them that they don't need it. I don't practice that way. I don't want people to look artificial. We're in this to make people look naturally beautiful, and I feel like when you change the way someone looks, you take away from that natural value. And a lot of injectors do practice that way, and to each their own, but I don't want my clients to look that way. And if they do present and they're a little bit overfilled, I just tell them I have to be real always. Honesty is the best policy, and I just say, listen, I think we can hold off. I don't think that you need this right now. Or I just reassure them everything looks good. This looks great. We don't need to add anything more currently. And I find a lot of people are like, really? Okay, great. No one really is upset with that. I've been blessed. I've got a good clientele that they're very reasonable and they understand. So yeah.
And that's good. I think that transparency, having it back and forth, is
you have to be
that trust. Yeah.
And again, whether that's in the aesthetic industry or whichever, you have to be, that is our patient provider role. You have to be that way. You have to be transparent. You have to have people trust you, always.
Now, this is a time where I want to dive deep into your Instagram and get some more context on some of your photos.
Yeah.
So let's talk about the photo with the lips.
Okay, so I post a lot of lip photos. Yeah. Lip augmentation is my favorite dermal filler procedure to do. I find that a lot of my clients come in for lip augmentation. I post a lot of it. That's what people want to see. It's, the lips can change the face so easily. And in a good way, of course, as long as it's done right. But yeah, the lip augmentation is my most popular dermal filler procedure. And I love lips. I think they're very sexy, pouty, and it just makes a woman or even a man just feel more harmonious with their features.
Is that like the South Florida trend down here?
It is. 100% it is. I think lips and Botox go hand in hand, and I find that once you start with Botox and you get your feet wet with it and you really like how it looks, you're more likely to jump into doing your lips and then augmenting other areas of your face that you were a little timid about or maybe didn't even know that you should have augmented. But yeah, the lips are the gate opener, nice. I would say, to the whole like dermal filler process, for sure, in my opinion. Yeah.
Which celebrity lookalike do you get the most? Like, I want to look like this person or this person.
Oh gosh, that's a good question. I can't even say.
Really?
Yeah, I don't really.
No Kim K.
No one. I really don't have a lot of clients that mention celebrities. Most of the time, they'll just look at my Instagram photos and they'll say, I like her lips. I like this set of lips. I get that more often than any celebrity.
Oh, that's cool.
And maybe you just don't know if the celebrities are filtered or not. Like, you don't know what they really have. So maybe that's why a lot of people don't mention celebrities, if that makes sense.
Yeah, and I ask that because like a lot of patients come into office with, they're trying to give you their expectations in their head and trying to paint that for you, right? Yeah. How do you translate that from them?
Right. So like that's a common question, and that's in every consult. That's like the first step. Yeah. Like, I talk to them about their goals, and everything has to be realistic because what you were born with genetically, you can enhance that, but I can't alter that. This isn't surgery, you know what I'm saying? So I have to tell them, listen, this is your shape. We can give you volume, but I can't make your shape look like this other person or picture because it's just not, you don't have that. And I have to be realistic with that so that they know, like, we're on the same page. Like, it's not going to be possible to change your mouth shape, as, upfront and blunt as that sounds. But you have to be realistic and transparent.
That's a good point because like people, like if they aren't happy with their results, they tend to write like different reviews or stuff like that, right? Yeah. And are you ever nervous about that when you're speaking to patients?
No.
Bad reviews or?
No, because I like to be upfront with them from the first minute that they walk in. Yeah. And I find that if you are not upfront and you're misleading and people find that they didn't trust you because you didn't tell them everything up front, then you're likely to get a bad review. If you spend the quality time with them and you answer all of their questions and you reassure them and you do your best, I find people value that and hold that more superior, and they're not going to leave you a bad review. If you're dishonest and you rush them through, I find that you'll get bad reviews that way because they didn't feel like you treated them like a human being.
Nice. Yeah. And I agree. I can definitely agree with that.
And, I mean, of course, there's people that you're never going to please. Whatever you do, no matter how good your aesthetic game was and how well you treated them as a person and a client, there's just some people that you're never going to make happy, and it's unfortunate, but those people, they're not going to be happy with anything or with whoever they go to, and those are the ones that can leave the bad reviews also. So it's more, you have to understand that those people, they're going to do that with anyone that they come across. You can't take it personal.
Nice. And so I also want to talk about the picture of you drinking wine.
Yeah.
We'll get some more context to that.
Yeah, so when I'm not working, I am drinking wine. That is my relaxation. That is my me time. That's what I do.
What's your go-to brand or your go-to?
Pinot Noir. I love a good Sonoma, California-based Pinot Noir is my thing.
Nice, yeah. It's dry, but it's a nice, you know.
It is, but it's also, you know, it has a little bit of a sweet taste to it. I really love it. Yeah.
Nice. Amazing. Thank you, Patricia, for sitting down with me and speaking more about the aesthetic industry.
Absolutely.
Tell everybody where they can find you, what you have planned next.
Yeah, absolutely. So Molle Aesthetics, Jupiter, Florida. In the near future, I will be expanding into a larger location. But you can find me on social media. My Instagram tag is bombshell_injector. You can also find me on Facebook too.
Nice. Well, until next time.
Yeah.
Bye.
Bye. Yeah.
Well, thank you so much, Molle, for sitting down with me, speaking about the aesthetic industry.
Molle, Patricia.
Oh.
You fucked up. See?
I did.